6 signs of bladder cancer. What are the symptoms of bladder cancer? Although some symptoms may be due to other problems, it is important to pay attention to all of them in order to get an early diagnosis. What are the signs of bladder cancer? The bladder is a muscular organ in the form of a sheath. It is characterized by its ability to compress and expand when it stores the urine produced by your kidneys. Bladder cancer occurs when malignant cells begin to grow uncontrollably along the inner membrane, forming tumors. Most cases of bladder cancer start in the urothelium, the inner epithelium of this organ. Early detection is crucial to avoid tragic consequences because within a few days it can spread to other areas of the bladder and nearby tissues. One of the problems, however, is the fact that many of the early symptoms can be misinterpreted because of their association with other conditions, making correct diagnosis difficult for many patients. This means that it is important to be wary of any signs, especially if you have some of the risk factors such as smoking and exposure to toxic chemicals. Today we will share with you 6 of the main symptoms so you will not hesitate to contact your doctor if you present them. 1. Blood in the urine. The presence of blood in the urine is one of the first symptoms of bladder cancer. It may vary in quantity, but generally, it will appear from time to time. Some patients will notice that their urine has changed color to pink or, in rare cases, darker. In other cases, the color of the urine appears normal to the naked eye. However, doctors may detect small traces of blood after a medical examination. These symptoms may persist for several consecutive weeks, or they may appear one day and disappear the next. If you do not treat this disease, the blood in the urine will reappear in the future. 2. Changes in urination habits. From the signs of bladder cancer. You should consider changes in urination habits as a possible sign of bladder cancer because they are almost always caused by an infection. This can mean a quick diagnosis of cancer. Consult your doctor if you notice any of the following. A recurring need to go to the bathroom, even when your bladder is empty. Increased urge to urinate at night. Urine flow is poor. You feel a burning sensation when you urinate. 3. Pain in one side of the waist. Urinary tract infections, as well as kidney stones and bladder cancer, can cause unpleasant pain in one side of the waist. Although it may initially be confused with muscle soreness, relapse and tension will guide you to the fact that something else has happened. It is important to pay attention to this, especially when accompanied by particular changes in the urine. 4. Loss of appetite. There are many factors to consider when losing your appetite. Among them is the possibility that it is due to a type of cancer. Patients who develop bladder tumors have a constant feeling of heaviness that can prevent them from enjoying food as they would like. 5. Weight loss. Loss of appetite and cancer stress can be combined to cause the patient to lose weight to an alarming level. Serious nutritional deficiencies can occur, and as your immune system weakens, cancer cells are even more likely to grow. 6. Feeling tired and anemia. Another consequence of loss of appetite due to bladder cancer is a strong feeling of fatigue, usually associated with anemia. When you are deficient in nutrients, the production of blood cells decreases and you receive less oxygen in your cells, resulting in the development of physical and mental fatigue. In conclusion, the symptoms described following could be completely harmless or indicative of a less serious condition. Also, you should have the proper medical tests done to see if they may be related to bladder cancer. Like other forms of the disease, rapid detection is the key to successful treatment.